Hello, my name is Katya Ledeen, and I'm the Laboratory Director for the Napa, Solano, Yolo, Marin County Regional Public Health Laboratory. I want to thank the committee for considering proposal number 27, Lab Aspire. And I'm here as a representative of the California Association of Public Health Laboratory Directors, which represents the 34 local and state laboratories in California, which function as a network to provide testing for outbreaks, emerging diseases such as Zika virus, measles, and Ebola, and routine testing for hepatitis, HIV, tuberculosis, water quality, and foodborne disease outbreaks. Proposal number 27, the Lab Aspire, is meant to address a severe shortage of leadership, which is currently impacting the public health laboratory network. Many counties are not able to find qualified personnel, and even the state laboratory is now 9 months into its search for a qualified chief of the infectious disease laboratory branch. As you know, every public health laboratory is required to have a director. However, due to overlapping state and federal requirements, there are only 6 additional qualified people nationwide who meet the new requirements to be a public health laboratory director in California. With 20 retirements expected in the next 5 years, we need to act quickly to train more individuals so that we don't lose our public health laboratory capacity. The previous Lab Aspire program started to address this shortage before it was cut in 2012. And some counties are benefiting from that program even now, including Los Angeles, Riverside, and Monterey counties. This new proposal is very focused on core needs of state and county labs and is designed to make quick and substantial improvements to this problem. Thank you very much for your consideration of our proposal.
Thank you. My name is Kat DeBerg with the Health Officers Association of California, representing the physician health officers in California cities and counties. We are here to advocate for proposals 27, 28, and 29. Each of these proposals represents an investment in preventing future expenses. Dr. Ledeen just went over number 27, Lab Aspire. Number 28 is the Tuberculosis Elimination Fund. Using wise investments and new tools, we could eliminate tuberculosis in the state by 2040, and that will result in much decreased Medi-Cal costs. And number 29 is the Community-Based Health Information Improvement and Innovation Fund, which Dr. Silver spoke to earlier, which it will prevent chronic diseases in California, preventing them before they start. So thank you very much.
Hi, good afternoon, everyone. My name is Julio Perez from Long Beach, California, and I'm here in support of item number 15, interpreters for Medi-Cal. And just very quickly, I want to share with you guys a story because I'm someone that was directly affected by the lack of interpreters in the medical system here in California. The story I'm going to share with you is about my little brother. He was born on April 3rd, 2003, and a week before his 5th birthday, him and I became very ill. So we got shots. I immediately got better. He did not. So my parents took him to Long Beach Memorial. Because there weren't any interpreters, I had to interpret for my parents because they weren't fluent in English. And so I had to interpret for them. The doctors were still very confused as to what his condition was. They said originally he had a bacteria in his bloodstream. And so they continued doing analysis on him. He spent his 5th birthday in the hospital watching cartoons, telling us that he wanted to go home. And they brought an interpreter to read my parents the liability forms. The interpreter never came back after my parents signed the liability forms. And so I had to interpret for them the whole process. They scheduled a surgical procedure for him to remove a sample from his spleen to verify exactly what it was that was affecting him. The day of the procedure, my mother walked into the room. They were placing tubes down his throat. He was left unconscious, and so he was placed on a respirator, on dialysis, multiple treatments, and he was on that for about another week. He underwent more procedures, including a surgical procedure on his neck, his thigh, and his lungs. because the respirator had punctured his lungs from the treatment. A day before he passed away, we met with the doctors, and they told us that he wasn't going to make it. So I tried to hold my composure, interpret for my parents, and so we questioned why they didn't tell us this sooner, so that maybe we could have taken him to another hospital. They told us that the outcome would have been the same, and so, you know, I thought it was very cynical of them. And so I just thought it was a lack of ethics, negligence, and I don't think families should be subjected to that. Once again, my name is Julio Perez, and I'm here in support of interpreters for Medi-Cal. So I'd like to ask for your support, and thank you for your time.
That. Thank you. Next witness, please.
Good afternoon, Madam Chair. Good afternoon to the committee. My name is Carlos Garcia. I'm a certified medical interpreter in San Francisco, and I'm here in support of the proposal to fund a medical interpreting program for Medi-Cal. I'm also here as the board director of the California Healthcare Interpreting Association in support of this proposal. You know, the public health officials, they keep saying that there is no shortage of medical interpreters in Medi-Cal. And I'm here also to tell you, I would like to speak to that fact that there is a shortage. I've experienced it. I've read reports as a California Healthcare Interpreting Association director. I'm also a board director of the National Council of Interpreting Healthcare. I've read the reports. As an interpreter, I see it when I go into a waiting room to interpret for a patient where I see another patient that does not have an interpreter. But also as a patient, I've felt it. I've lived it. When I was going through chemotherapy a few years ago, I had to interpret for another patient who did not have an interpreter, who could not speak English. The doctor felt awkward at that time about asking a cancer patient to help another cancer patient. I can understand. I mean, he must have had some moral or ethical issue with it. So he decided to call the staff interpreter of the hospital, who turned out to be the janitor. I have nothing against janitors, but the broken interpretation led to the provider ordering unnecessary tests. And so that's how hospitals have to get by, and that's why they say there is no shortage, because they assign healthcare workers that are not qualified to do this kind of job. Lastly, to conclude, I want to piggyback on what Senator Stone said about providing vision exams, payment for vision exams, but not paying for the hardware. What point does it make to pay for healthcare services for patients that do not speak English? Well, if you don't provide the ancillary services to access those healthcare services, it doesn't make any sense. Lastly, and I said that I was going to conclude with that, but lastly is healthcare hospitals do assign healthcare workers that are not qualified to do this kind of job. How does it make sense to have a billing specialist take an X-ray just because he's done it before? It doesn't make any sense. You will get an image, all right? Who knows what kind of image? But when it comes to interpreting services, the outcomes, you can't really tell what the outcomes are. There is one infamous case of Willie Ramirez where he went into an emergency room, and the interpreter that was helping him was not an interpreter, but was helping him, told the nurse, the triage nurse, that he was intoxicated. The word in Spanish was intoxicado, so the person said intoxicated. The nurse thought the patient was drunk and told him to go sleep it off. A few hours later, they woke him up, and he ended up being quadriplegic. So there's the real cost to this. He got awarded $71 million in a lawsuit, but still that does not commensurate to losing the ability to move any of your body parts. And that's how important medical interpreting is. I ask for your support and also to be included. Thank you.
Thank you very much. Next witness, please.
Good afternoon. My name is Sandra Castillo from Interpreting for California. I'm here to humbly ask you for your support on item number 15 when it comes to a vote.
Buenas tardes, mi nombre es Guillermo García, soy padre de 3 hijos en la ciudad de Oceanside. Gracias por permitirme hablar el día de hoy aquí. Hace 5 años que mi esposa Elizabeth fue llevada al cuarto de emergencias. Ella solo tenía 42 años, pero le dio una derrame cerebral. Yo la visitaba en el hospital todos los días, no había intérpretes. Mi hijo Guillermo Israel era mi intérprete de tan solo 9 años de edad.
Good afternoon. My name is Guillermo Garcia Rodriguez. I am a father of 3 from Oceanside. Thank you for allowing me to speak today. I rushed my wife to the hospital, to the emergency room. She was only 42 years old from my terrible stroke. I was visiting her every day in the hospital. There was no interpreter. My son, Guillermo, he was only 9 years old, was the interpreter.
Yo buscaba a alguien con cara hispana para decirle que me ayudara a comunicarme. Mi esposa no podía ayudar mucho. Nadie nos escuchaba cuando les decíamos que ella se estaba ahogando y estaba en vida artificial.
I looked for anybody with a Hispanic face to tell them to help us to communicate. My wife was helpless. No one was listening to us when we were saying that she was choking with their life support tubes.
Entonces, ella falleció y les tomó a ellos más de un día para encontrar a alguien que me pudiera informar de lo que había pasado, porque ella se había ahogado, se vomitó y eso causó infección en su sangre y llegó hasta su cerebro, causándole la muerte.
Then she died, and it took them over a day to find someone to tell me what had happened in my language. Because she was choking, she choked with her own vomit, her blood got infected, and then it reached to her brain.
Estoy aquí para decirles que mi esposa Elizabeth murió sola, sin ayuda, porque no había alguien que hablara español. Nosotros necesitamos intérpretes médicos. Por favor, apoyen esta propuesta de ley. Muchas gracias.
I'm here today to tell you that my wife, Elizabeth, died alone and helpless because there was no one who was speaking Spanish. We need medical interpreters. Please support this request. Thank you.
Thank you very much. Thank you for your personal story.
Thank you.
Next witness, please. We're going to try to wrap committee up in the next 10 minutes or so.
Lunch is close. Madam Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation. I would take a moment first to focus on item 22, which is the $10 million request for the STD control branch at the Department of Public Health. I'm sad to say the state of California has made very little investment in controlling an out-of-control epidemic of STDs in this state. While it's an epidemic that has hit communities of color particularly hard, it's not an epidemic that is limited by demographic or geography. In the last full 5 years for which statistics are available, not a single county experienced a decrease in STDs. Every single county saw an increase, some as high, believe it or not, as 395% over a 5-year period, that in Butte County. Los Angeles appears to be a smaller percentage, 47%, but the raw numbers for Los Angeles are huge. So it's about time for the state of California to step up and provide some additional funds for this. We are only spending $1.6 million in a state of $39.3 million, 39.3 million people to cover this epidemic. We have asked for $10 million. We think that's a reasonable, if nominal amount. But let me be honest, when it's only $1.6 million, if you threw another million at it, that would be a windfall for this program. And we can encourage you to consider some appropriation for this program. I also want to stress on behalf of AHF our support for items 9 and 10, the elimination of the AB 97 rate reduction process, as well as item 11, the increase to the AIDS Medi-Cal waiver program. Thank you very much.
Thank you, Chair and members. Reed Addis on behalf of the Breast Cancer Fund here today in support of the item 25 that augments the biomonitoring program here in California. 10 years ago, the legislature and the governor took a leadership step in establishing this biomonitoring program, and what's important about that is you wedded science with the understanding of the chemical exposure to the body. That created information that you as policymakers and our state agencies could use to understand the impacts of chemical exposures on our bodies and to take action to minimize those. What's really important about this program is it's actually sophisticated enough to not only understand the chemical exposure to an individual body, but also to communities. It can understand how to look at various ethnicities, communities of color, special community areas where there may be special hotspots related to toxic exposure. It is because of that value of the program that we're in strong support today of the augmentation, because we think that augmentation could be used by the biomonitoring program to have an environmental justice element and look at additional communities throughout the state who have in particular or have particular chemical exposure issues. So thank you and in strong support.
Good afternoon, Jennifer Tannehill with Aaron Reed and Associates on behalf of the California Dental Hygienists Association. We wanted to voice our support today for the full restoration of the adult dental benefits. That's something that's really important to us, as well as item 19, the Children's Dental Disease Prevention Program. This program operated really well from 1980 through 2009, and it was really critical to providing children with preventative dental hygiene care that they wouldn't otherwise receive. That school setting is a really important avenue and access point for those children to be able to receive that preventative dental hygiene care, and it's something that the Little Hoover Commission had found out in their report as well as the state auditor's report, that this is something that's very needed. And we also support item 20, the virtual dental homes appropriation. There's still entire counties that don't have a dentist that takes DentaCal, and CDHA fully supports using the virtual dental home model as a way to increase access to dental care, and we support the appropriation. Thank you.
Good afternoon, Madam Chair and members. Megan Allred on behalf of the California Dental Association. Wanted to speak on number 19 in support, CDA's in support of restoring the dental disease prevention program under the direction of the state's new dental director and in line with the state oral health plan. Restoring D2P2 provides an opportunity to fund the local infrastructure necessary for the implementation of the state plan, which will be released later this year. And there's a need for school-based programs and linkages to care, and we believe that a version 2.0 of this D2P2 program can provide the foundation for this. In support of number 20, CDA and the Children's Partnership are currently co-sponsors of AB 648, which mirrors this budget ask. The $4 million one-time investment in the virtual dental home program will help provide low-cost preventive dental care to children and adults who face barriers to accessing care in traditional dental locations. The VDH model uses technology to connect allied dental team members located at community sites with dentists and offices to provide comprehensive, low-cost care. The requested budget allocation would fund or would facilitate the VDH expansion, fund training, community-based collaboratives, and technical assistance. VDH has the potential to become a sustainable and scalable model for dental care delivery, but needs this upfront investment. So the program would be implemented under the leadership of the dental director and would build upon the successful pilot program previously administered by OSHPD. And then on my last one, going out of order, on number 7, the restoration of Medi-Cal optional benefits. CDA supports access to comprehensive oral health care services. However, we want to ensure that any benefits that are restored can actually be delivered. So over the past several years, the number of Medi-Cal eligible adults has increased dramatically, yet the number of dentist or DentaCal providers has declined. We need to work on fixing the system and bringing providers into the system before we restore these important benefits and then aren't able to provide them to the adults. And on that, when Senator Stone and some other of the presenters, including the Little Hoover Commission representative and many others who spoke so eloquently about rates for dental providers, wanted to support the proposal and some of the discussions that have gone through about fixing the DentaCal program, and just to really stress the importance of a multifaceted approach and additionally funding provider rates to be a part of that solution. We appreciate all the attention that has been given both in this subcommittee as well as in the legislature and DHCS to DentaCal, but we know that there's a lot that remains to be done in this program and to address the shortfalls highlighted in all of those studies and audits. We're pleased that there are a lot of discussions on the table, including legislation that's going through currently to infuse some money into the system, and we support targeted rate increases and the multiple other proposals that people have discussed, because we know that we need providers. So thank you very much.
And last one, Khadija Alam Javed with the Advancement Project. Here in strong support for item number 3, expansion of medical coverage for regardless of immigration status, for the reasons previously stated at the very beginning of the public comment section. Thank you.
All of the members of the public who provided public comment on these investment proposals. Thank you, colleagues. Any closing comments or anything you wish to say? Okay, thank you very much to LAO and Finance, and the subcommittee meeting is adjourned.